Hello, everyone. I'm Ademola Itiola, and I'm a PhD candidate at APERSU. I'm supervised by Jeff. I also have Dr. Shajobi and Dr. Marshall as part of my supervisory committee. What I will be presenting is an overview of my thesis, which is on response shifts and its implications for healthcare decision-making for patients that have undergone knee replacement in Alberta. Yeah, so in case you're wondering what response shift is, so let's consider Sky. Sky has been living with knee pain for some time due to osteoarthritis. And because of his reduced mobility, he requires a cane to actually move around. And because he's been with knee osteoarthritis for some time, he has accepted his physical limitation as the new normal. And his expectations in terms of what he can actually achieve in terms of his physical mobility is kind of low at this point. He's undergone an assessment and he's been booked for knee replacement surgery. As part of the procedure, he's been asked to actually complete a questionnaire to actually assess his level of pain. He's meant to assess his level of pain using a questionnaire on a scale of 1 to 5, 1 being that he has no problem with mobility, and 5 meaning that he's unable to walk. In coming up with his rating, he tried establishing some internal standards. So 1 is still what it is, which is no problem with mobility. 5 is unable to move around. At this point, he thinks a 2 would be that he can actually walk short distances without requiring a cane. And I think a 3 would mean that he requires a cane for most of the walking, even though he can still sometimes walk without requiring a cane. He thinks a 3 is actually represents his current condition, and so he assigned a rating of 3. As his current level of mobility. After some time, he had his knee replacement surgery, and 3 months after, he's now able to walk without needing a cane. He's asked to complete the same questionnaire to assess his new level of mobility using the same questionnaire. But now that his condition has improved, his expectation is now higher than what it used to be. So now he repeated the same exercise he had the first time, but now he has a new set of internal standards. So what used to be a 2 for him now becomes a 3. So he thinks a 3 will be walking short distances without needing a cane, all because his expectation has gone up. At this point, he still assigns a rating of 3 for his new mobility level. And of course, it's quite obvious that his physical condition has apparently improved, but while the rating actually appears to be the same at this point is because the internal standards he's actually using at this point after the surgery is quite different from what he used before he had the surgery. So you would see that what was a rating of 3 before surgery would have actually passed for a rating of 4 after the surgery. And if you had looked at his PROM score before surgery, I mean, if you look at the PROM score without considering the switch in the internal standard, in this case, the shift in the internal standard would have actually erroneously concluded that the surgery actually had no effect. But whereas if you had actually asked, if you actually had Sky in this instance to actually reflect back based on his current set of standards and given a rating of what his level of mobility was before the surgery, it would have been a 4 and would have apparently seen that the surgery actually had an effect on Sky's level of mobility. What we're seeing here is recalibration response shift, where the internal standard has kind of changed due to a significant health event, and in this instance, due to surgery that Sky had undergone. In summary, response shift, as we've seen an example of Sky, is actually change in the meaning of one's self-evaluation of a target construct of health status, and it can be due to change in internal standards, given the example I just cited. Another possibility is actually change in priorities, in which case it's going to be reprioritization. So still using Sky as an example, before the surgery, this would look more like what would have been Sky's ranking of the various dimensions of health. Because he had limited mobility, it's very likely to have rated mobility, pain and discomfort higher up on his priority list. But after the surgery, after gaining increased mobility following the surgery, is most likely likely to deprioritize mobility and maybe now focus more on mental health. And in this instance, I would say that Sky has actually undergone reprioritization response shifts. Another possibility is actually reconceptualization. And in reconceptualization, the definition of quality of life before and after a major health event. It could be a surgery, as the instance I just cited. Sometimes it could also be due to the diagnosis of a disease condition. It's not exactly the same due to some of these adaptations and also changes in expectations. So in general, despite the importance of response shift is typically not considered when interpreting prompts data. And because of that, there's some instances where we have some paradoxical findings. So sometimes patients that you would expect ordinarily should have deteriorating health condition, and in fact, they may have deteriorating physical health condition, might show stable PROMS outcome when you compare their longitudinal PROM scores. And so we can see that actually taking this into account would have implications for the interpretation of intervention effect. In the case of Sky, would have concluded that the surgery had no effect, whereas it truly does if you had factored in response shift. Another reason why response shift is important is also in setting of treatment priorities. So we can also see in this example that after surgery, patients might actually, or after receiving an intervention, patients might actually adjust their priority, and that would have implications for their clinical management. So my thesis is actually focusing on bridging the response shift research gap for knee arthroplasty patients in Alberta. Most of the studies that have been conducted so far has used DEN tests, where the patient is actually asked to recall what their health status was before the major health event. But this method is actually subject to recall bias, and also for you to use it within an administrative setup, you need additional investment in data collection. Most of the studies have also included a limited number of patients. And I think it is important to note that even though response shift effects could be small, it can actually have implications for interpretation of effect size of intervention. So an effect that's been otherwise considered medium could over time become large. For my thesis, I'm going to be using data from Alberta Bone and Joint Institute, focusing on the routinely collected WOMAC and also EQ5, the PROMs. I'm going to be applying statistical techniques, so currently considering alt structural equation modeling and also Rosali RMT, so response shift algorithm in item response theory, rash measurement theory. And I'm going to be looking at some changes in the model parameters to examine the presence of response shifts, and if present, what's the effect size, and also the timing and which of the PROM's dimensions are actually affected by response shifts. I'm also going to be looking at potential factors that are associated with response shifts. And the last objective I actually have is looking at how response shifts actually varies with EQ5 prompt. So looking at how it varies with 3L versus 5L. So just to touch on some of the significance of this research. So we'll be able to know what type of response shift exists within this group of patients and what to actually look for while interpreting prompts data. We're also going to be looking, having information around recommendations around how prompts data should actually be adjusted to estimate true effect size. And the last point here is that there's going to be information as to decide whether adjustment would be required depending on how health is conceptualized. Right now, the analysis is still in the preliminary stages and would have findings to present over the next couple of months. Thank you.